So if you have a hemodialysis access like a fistula or a graft, you need to know about Still syndrome because this is something that can happen. Still syndrome is when you start developing pain in the same arm of the dialysis access. The pain is usually in the hand. It can be when you're using the hand or during dialysis, and there is often associated numbness and sometimes even weakness of the hand that may prevent you from doing things you need to do. If you develop pain in your hand, the first thing we need to do is find out why is this developing, because there are multiple causes of Still syndrome. It could be a problem with the arteries that are taking the blood flow to the hand, or it could be a problem with the vein that may be too large. So the first thing we need to do is to do a very complete ultrasound of your arm vessels, including the arteries and the veins, and we can do this in the office. The problem could be a narrowing at the beginning of the artery, which would lead to lack of blood flow to the arm. If that's the case, we know that we have to treat with the placement of a stent in that area, and that's a minimally invasive procedure that can be done by inserting a catheter to the groin and navigating this catheter through the blockage and taking some pictures by injecting some dye, and then a stent can usually be placed with no problems improving the blood flow. But sometimes the cause of the Still syndrome may be narrowing in the more distal arteries going to your hand, the arteries in your forearm, or even the arteries in your wrist. But most of the times, the main problem is that the connection between the artery and the vein is too large. And one way that we can determine that is by measuring the blood flow in the fistula. And usually those patients have a blood flow of over 2 liters through the fistula. So there's essentially all the blood flow is going through the vein and not much is going to the arm. Usually the easier way to treat it is to decrease the size of the vein, and we can do it a simple procedure that can be done as outpatient called bending. In this procedure, we make 2 micro incisions around the access, and we can put a cerclage, which is a stitch, around the access, and we can tie it, and we can calibrate to whatever size that we want. We usually choose around 4 millimeters, seems to be a good number. And this cerclage, this bending, it's also reversible since we can always break the sutures later with a balloon and maybe change the size if it's necessary. In some more complicated cases, or if the hand is really ischemic and the fingers are getting necrotic, sometimes we have just to close the access altogether and maybe make a new one somewhere else. I really hope you never develop this Still syndrome, but if you do, you should know there are options to treat it. This is Minimally Invasive Insights, and I'm Dr. Fabio Comos.